Hello, ladies and gentlemen. Welcome to Triple N Media. I am NIK NIKAM. And this is COVID 19 pandemic world news update April 5, 2021, Wave 3, vaccine side effects, and much more. So let us begin. As of April 5th, 2021, there have been more than 132 million cases of COVID 19 reported all across the globe, accounting for 2.867 million deaths in the world. This COVID 19 pandemic, which started in Wuhan, Texas in 2019, spread to the rest of the world, which was gripped with the first wave during the month of March and April. Then it continued on, and these are the total number of cases across the globe. Then we had a massive second wave, which peaked around the first week of January, reaching more than 800 cases per day across the globe. And now we are seeing a resurgence of these new cases, reaching approximately the same number as a third wave. It looks like there is no relief of this COVID-19 pandemic despite widespread use of vaccines and continued self-mitigation rules and lockdowns. In Europe, especially in Germany and France, there has been a significant surge in the number of new cases in the last several weeks. As we can see, they had peaked at like approximately 70,000 cases in October and November. Now they are approaching similar numbers with almost 60,000 new cases in France as we speak. And at the same time, France is getting ready to implement the third nationwide lockdown at this time. They're going to decide this week as to what kind of lockdown they're going to have to contain this widespread increase in the number of new cases in France. We have a similar story in Germany, where in the first wave they had less than like 8,000 cases. Then it jumped all the way to 30,000 cases during the second wave, and the third wave is almost approaching 25,000, and it seems like there's no sign of release at this time. Germany has been pretty active in getting the vaccinations done, and they also hit a roadblock as far as AstraZeneca vaccine is concerned, which we will cover in a couple of minutes. Similar story is seen in Brazil, which had its second wave during August and September, and now the third wave is far exceeding the previous waves as the number of new cases approach almost 100,000 per day in Brazil. India, which had done exceptionally well compared to its population of 1.3 billion people, in the first monolithic wave, it had peaked during the middle of September, around 100,000 cases per day. But now this third wave or the second wave, as you would see here, it far exceeds 100,000 cases per day. And especially major cities like Mumbai, New Delhi are hardest hit with number of new cases due to population density and congestion. Let's switch gears and see what's happening in the vaccine world. As we know, we have several vaccines available now, starting with Moderna, BioNTech, Pfizer, AstraZeneca, Johnson & Johnson. Then we have vaccine from Russia, also a couple of vaccines from China, and another vaccine from India. With all these vaccines available, 665 million people have received at least one dose of this vaccine, which amounts for 10% of the population, which is a significant milestone, I should say. But it is very sporadic when you look at which countries have had the maximum vaccination compared to the other countries. Israel stands out with 59% of the population having received at least one dose of vaccine, and 54% having received full vaccination. And of course, UAE comes next with the 8.57 million doses of vaccine administered. UK is also in the front line with 47% of the people receiving the first dose and 8.1% receiving both doses of vaccine, whereas in the United States, 165 million people have received the vaccine. That accounts for 32% of the population which has received at least one dose of vaccine, and 20% of the population has received 2 doses. If you combine that with almost 20% of the population which already had COVID infection, we are approaching close to 40% of the population which has some degree of immunity towards COVID-19 infection. When we are talking about immunity, we are talking about immunity towards the original variety of COVID vaccine. However, the new variants like the UK variant, the South African variant, and the efficacy of these vaccines have not been fully established, even though they claim their vaccines are fairly effective in dealing with these coronavirus variants. As we see these vaccines being rolled out and millions of people receiving the vaccine, we are also facing some challenges as far as manufacturing and side effects. Johnson & Johnson had to discard 15 million doses of vaccine because the manufacturing plant mixed up the formula from another vaccine with the Johnson & Johnson vaccine, and as a result, they had to discard 15 million doses of their vaccine. The biggest news seems to be coming from AstraZeneca, which has had more than 60 million people receiving this vaccine, but nonetheless, there have been concerns about AstraZeneca having significant complications, such as intracranial. The AstraZeneca vaccine has been shown to lead to blood clots in the brain and deaths. In fact, more than 30 people were noted to have this complication in Germany and in other parts of Europe. 7 people have so far died from this vaccination, but nonetheless, the European Union and the UK healthcare experts feel the risk is very small compared to the millions of people who have received this vaccine, and they feel it is safe to use this vaccine. However, Germany and other European countries have advised not using the AstraZeneca vaccine in people who are younger than 60 years old. Surprisingly, the blood clot complications have been found mostly in the European country population, whereas the AstraZeneca, which has been widely used in India, has not shown similar complications. Let's talk about the effectiveness of these vaccines, and are they really good? As we know, majority of these vaccines, especially Pfizer, Moderna, and Novavax, AstraZeneca, have 80 to 95% efficacy in preventing symptomatic COVID disease and hospitalizations. Johnson & Johnson was found to be 66% effective, but remember, Johnson & Johnson was tried in South Africa and in the United States, so Johnson & Johnson has been shown to be effective against the South African variant. In addition to that, in Johnson & Johnson, Moderna, BioNTech studies, there have been no significant increase in admissions to the hospitals. There have been no reported deaths among this population, and the number of symptomatic patients is very small compared to the placebo group. So what basically it means is these vaccines are very effective in preventing symptomatic COVID-19 infection. These vaccines are extremely effective in reducing hospitalizations. So those are the main important things that we need to be concerned about when we are talking about vaccine. If you are thinking about whether I should get Moderna or Pfizer or Johnson & Johnson or AstraZeneca, I think the main question you want to be answering is, can I prevent symptomatic COVID-19? Does the vaccine prevent hospitalizations? And if those are the questions, most of these vaccines do reduce dramatically the incidence of COVID-19 symptomatic infection, and they significantly reduce hospitalizations. So on those premises, all these vaccines are quite effective. I would get the vaccine whichever is available and reduce the chances of getting symptomatic infection or reduce the chances of hospitalization. Ladies and gentlemen, you have been watching the COVID-19 Pandemic World News Update, April 5, 2021, Wave 3 and vaccine side effects. I am Dr. NIK NIKAM, and please do subscribe to our YouTube channel, and we will see you next time.